Hello everyone, my name is Bhavya, and today my group and I will be discussing the importance of epidemiology and its application when considering foodborne and diarrheal diseases, while also talking about managing a foodborne poisoning outbreak and its implications on public health and clinical medicine. Throughout this presentation, our group will be explaining the significance of epidemiology in public health, a deep dive into our food poisoning outbreak at Community University, emphasize the connection between public health and epidemiological practices, examine how similar foodborne outbreaks are handled and addressed today, focusing on trends and recent cases, analyze the long-term effects of past outbreaks on public health policies and practices, discuss how this case study has influenced changes in food safety, public health awareness, and healthcare practices, and provide concluding remarks. So first, let's try to understand epidemiology and its relevance. It's very relevant in disease monitoring. Epidemiology tracks disease occurrence, distribution, and determinants within the communities. It also tracks the incidence and spread. It collects data on affected populations, transmission, and sources to understand outbreak dynamics. Epidemiology also plays a role in epidemic identification. It detects early signs of potential outbreaks and emerging disease trends. It's also essential in early interventions. It enables proactive planning for control measures and rapid response strategies. Alongside timely actions, it helps in reducing outbreak impacts through swift and informed actions. It's also important to note that epidemiology is a collaborative approach. It involves teamwork among a bunch of healthcare professionals and organizations for effective disease control and information sharing. Epidemiology also plays an important role in monitoring the occurrence of diseases within our communities. Thus, by tracking the incidence and spread of diseases, epidemiologists tend to identify potential epidemics and trends in order to ensure early control and implementation of interventions. Epidemiological studies are fundamental in helping identify the risk factors and causes associated with diseases in question. Thus, this information is vital in implementation of effective control and preventative strategies, including public health campaigns and policy developments. A deep dive into case study, foodborne illnesses. Our case study involved studying a recent outbreak of food poisoning at a community university, where the disease had adversely affected 300 faculty, students, and staff, where individuals became ill 2 to 6 hours after consumption of cafeteria food. Their symptoms consisted of gastrointestinal discomfort, bloating, nausea, vomiting, explosive diarrhea, and mild fever. This case study highlighted the outbreak investigation process within the field of epidemiology. For instance, it emphasized the importance of analyzing and collecting data relating to a specific place, person, and time. It further illustrated the importance of food handling and contamination in the lunch kitchen, which led to identification of a common source outbreak, leading to severe economic and health consequences. Common source outbreaks are foodborne illnesses where a group of individuals end up falling sick after consumption of a shared contaminated food or beverage. As seen in our case study, we will be deep diving into this investigation and how the study can inform public health efforts to mitigate similar outbreaks in the future while improving food safety practices. This case study of food poisoning outbreaks offers a contemporary perspective on how epidemiology is employed in real-world applications, as this field serves as the backbone of the entire outbreak investigation. It helps epidemiologists distinguish the causative agents while also using the study to further implement effective control measures in tackling infectious diseases. For instance, this case highlights the importance of analyzing descriptive information which concerns the location and context of the outbreak, in this case the kitchen, the individuals affected, in this case the staff, faculty, and students, and the temporal distribution of the cases, or the time.
The case study highlights the persistence of foodborne illnesses, which impose a substantial global health burden in both developing and developed countries. Approximately 600 million individuals, which is nearly 1 out of 10 persons globally, experience illness due to consumption of contaminated food. This further leads to 420,000 fatalities annually, further leading to a loss of 33 million healthy lives a year, as evaluated by the disability-adjusted life years. Focusing primarily on public health settings such as community hospitals, nursing homes, educational institutions, and childcare facilities can further emphasize the ubiquity of foodborne illnesses in different environments where food handling takes place. This case study also explains how diarrheal and foodborne illnesses trace back to inadequately trained kitchen staff, dealing with mishandling of food storages and preparation, which further leads to cross-contamination. Thus, adhering to safe and effective food safety practices is vital in prevention of emerging common source outbreaks. The study also emphasizes that outbreaks are detrimental to public health as they are expensive to manage and assess adequately. Thus, epidemiologists underscore the primary prevention as more efficient and cost-effective approach to alleviating the impact of foodborne illnesses. We believe that technological advancements and surveillance systems have tremendously enhanced early detection of foodborne outbreaks. For instance, the use of modern monitoring platforms like the Global Health Public Information Network, alongside the use of social media for monitoring health, has significantly enhanced the timeliness of reporting. Improved crisis management and sharing of information in an adequate and timely manner among stakeholders has ensured the rapid response and communication today. For instance, during the COVID-19 outbreak, public health agencies collaborated with organizations to further collaborate with laboratories for early reporting, further establishing strict guidelines on monitoring and reporting of COVID-19 cases to better track the spread of the virus. Thus, public health efforts to educate the general public on hygiene, food safety, and other measures have enabled consumers to make informed decisions for betterment of their health. The interconnectedness of the world requires firm communication to take place. Thus, organizations such as the Food and Agriculture Organization and the World and Health Organization work together to ensure global food safety concerns are addressed and solved effectively. For instance, in 2018, the U.S. experienced a foodborne outbreak which was linked to contaminated eggs caused due to Salmonella, a bacteria which is commonly associated with poultry products. Thus, this outbreak required effective communication between the Food and Drugs Administration, the FDA, and Centers for Disease Control and Prevention, CDC, leading to the effective tracking of the common source while implementing measures to prevent the spread. Overall, global collaboration and regulatory enhancements by agencies to improve food safety, inspections, and standards is vital in applying risk-based approaches when considering food safety. In response to food outbreaks, such as the one at Community University, a regulatory agency such as Health Canada have ensured to take measures to strengthen regulation for food safety. For instance, a recent foodborne outbreak caused by a norovirus linked to raw oysters from British Columbia affected approximately 192 individuals as of June 1st, 2022. The CDC, FDA, alongside the Public Health Agency of Canada and the Canadian Food Inspection Agency, investigated a multi-state outbreak pertaining to the norovirus diseases. Thus, these agencies work together in attempts to discard any remaining contaminated oysters from local sources and provided safety guidelines such as ensuring to wash hands with soap and warm water, sanitizing surfaces, utensils, and containers when coming into contact with raw oysters during preparation and processing of food.
Today, we believe that institutions and public health agencies have recognized the significance of properly training food handlers and kitchen staff in order to prevent cross-contamination. Moreover, real-time tracking and data sharing of foodborne illnesses are deemed effective, allowing for quicker response and detection to potential new outbreaks. High-profile foodborne outbreaks, such as the ground beef contamination caused by E. coli in HelloFresh meal kits during July 21st, 2022 within the United States, have raised public awareness regarding potential health risks associated with contaminated food consumption, while also highlighting the importance of safe food handling. Thus, learning about the community university outbreaks alongside the current similar outbreaks in the world have highlighted the importance of taking preventative measures for rigorous food safety practices. Due to the global food supply chain, foodborne illnesses often have cross border implications. For instance, the norovirus outbreak linked to raw oysters had affected the provinces of Manitoba, Saskatchewan, and Ontario, along with US states such as California, impacting individuals from various regions. This eventually led to international efforts in order to control and reevaluate the safety standards and collaboration when investigating the outbreak. Such outbreaks underscore the significance of the One Health approach, which acknowledges the interconnectedness of environmental, animal, and human health. Thus, a comprehensive approach which involves multiple disciplines should be taken into consideration when investigating the origins of the foodborne pathogen. This case study serves as a poignant reminder of the interconnectedness between epidemiological vigilance and public health infrastructure. It not only advocates for stronger regulatory frameworks, but also calls for a more inclusive health approach. In the wake of this outbreak, it's evident that proactive measures, such as continuous education on food safety and hygiene and up-to-date vaccination protocols, are indispensable. These strategies not only mitigate immediate health risks, but also contribute to the foundation of a resilient public health system capable of withstanding future outbreaks. This incident therefore acts as a catalyst, propelling advancements in public health, readiness, and clinical preventative measures. We believe that regulatory authorities should place stronger emphasis on being compliant with food safety regulations to mitigate the risk of foodborne illnesses in universities where the food is served. Moreover, considering the foodborne outbreak is a diarrheal disease as well, proper sanitation and hygiene practices is important. Thus, investigating in washrooms, investments in clean water sources, and sanitation facilities is important. Enforcing vaccination programs against specific pathogens like the rotavirus in schools and universities has been very successful in reducing the incidence of diarrheal disease, specifically among the children. More importantly, public and clinical health practices should be mindful of ensuring equitable access to medical care among rural areas alongside vulnerable populations to further manage and prevent severe cases of diarrheal illnesses. Regular inspections are important to routine inspections by healthcare authorities in order to ensure that food safety guidelines are adhered to. Thus, these inspections can help rectify potential issues before they lead to outbreaks. Public health enforcing food handlers to require food safety certifications is crucial, as individuals have completed training in safe food handling practices. Moreover, the outbreak has caused consumers to be more vigilant in regards to the food they consume, specifically within a public setting. Given that students, staff, and faculty are more aware of the food consumed, public health should encourage them to report suspected cases or any potential hazards with poor food handling or preparation. Therefore, this outbreak has emphasized the significance of driving changes in public health awareness, collaborative surveillance practices, and education, which ultimately strives to reduce foodborne illnesses in educational institutions throughout the globe. As such, from this case study, we learned the importance of epidemiology in addressing foodborne illnesses and its impacts on clinical medicine and public health. The presentation also highlights the significance of taking preventative measures while effectively communicating for cross-border implications. Focusing on the hygiene practices, raising awareness, and vaccination programs is vital in mitigating the risks associated with foodborne illnesses. And we hope you enjoy learning about our case study while getting a comprehensive overview on epidemiology and its real world applications. Here are the references. Thank you to all our group members, Shivani, Samuel, Bahavia, and myself for contributing to this presentation. Thank you for listening.